Hello, 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 hello. Okay, good morning. Looks like no glitches. Sound check is good. And I'm getting report from all the participants. They're hearing it well. So today is Saturday, February 26, 2022. This is our regular scheduled yoga therapy class, which we have been doing in person for a long period of time. And now during pandemic, we are in virtual. And all of our sessions, all of our presentations are based on our extensive experience, extensive research, extensive participation with all the yoga therapy communities. So today's topic is yoga therapy, breathe and burn. What does breathe and burn means? Let me explain to you a little bit. That I'm going to show it to you how it affects your body and mind. First, the evidence. We have one participant. I'm just looking at her name. I'm not going to mention the name. She has been practicing with us for a long time, and she is a regular daily practitioner of a yoga practice, primarily a very relaxing asanas and a structured pranayama practice, which you do in our yoga therapy every single day. 7 pranayamas, first 3, Bastrika bellows, your Kapalbhati Pranayama, the breath of fire. The bellows is called the prano pradhan. It brings the prana in your body. The Kapalbhati Pranayama is called the Agni Pradhan. It brings the Agni, the digestive fire. It is called the Metabolic Pranayama. And then Anulom Vilom Pranayama, or alternate nostril breathing, which is called Vayu Pradhan Pranayama, which balances our vata. Then we incorporate at the beginning exhalation longer than inhalation. Then we incorporate a Brahmri Pranayama, bumblebee breathing, Ujjayi Pranayama, which is called a resistive inhalation, victorious breathing, Shankar Pranayama, conch shell breathing, which is your resistive exhalation, and then Sitali Sitkari, called cooling pranayama, and finally Pranabha Pranayama or Om Pranayama, which is a meditative chanting pranayama. So the first, our evidence is the person who is been practicing a daily pranayama practice lost about 40 pounds of body weight. All the blood chemistries became normal. All the doctor's visit shows a perfect sign of health and blood chemistry. Second person who came to us a long time back He was 53 at the time. He had a typical metabolic syndrome. He had a truncal obesity, a severe truncal obesity. He had a diabetes, almost uncontrolled. He was on 4 or 5 medications, a hypertension, he had a coronary artery disease, high cholesterol. Make a story short, he was on 18 medications when he came to in our class. He was little also heavy. I said about 200 pounds, maybe 220 or 250. So he was sitting on a chair. He was doing some relaxing asanas, relaxation of the muscles of respiration. Then he was primarily doing Bastrika, Kapalbhati, and Anulom Vilom Pranayama. Bellows, breath of fire, and alternate nostril breathing. Initially, he was not very happy. There was not too much changes. After a while, he noticed that his belt, when he was tightening his belt, it was gone down almost 2 notches down. That clicked him. Since then, he became a daily follower, avid practitioner of pranayama, doing over 500,000, sometimes 2,000 Kapalbhati Pranayama, like breath of fire. He has included his family, especially his young son, and essentially, after some time, he was off all the medications and was enjoying a disease-free, medication-free quality life. We have a lot of other examples, but let me tell you what happens. Breathing, for us, it's a work. It's called work of breathing. Work of breathing means we inhale, we breathe out first, we take a deep breath in. During this process, all the muscles of respiration, which are called skeletal muscles, are working. We generally, in yoga practice, we breathe out first because lung is like a balloon. It has 6-liter capacity. It needs 1.5 liter to keep it open. 4.5 liter you can exchange. So once you remove the toxic carbon dioxide from your lung, you can inhale more oxygen. So you inhale because there is a pressure difference from outside and inside the lung. So the work of breathing, or we can also call it power of breathing, work of breathing in simple physics or mathematics will be the pressure difference times volume. That is how much pressure difference we have times the amount of air we can put in. If you can increase the amount of air you can breathe in, which all of us has done, like large number of air comes in, it's almost some 2, 3, sometimes 4 times the normal amount of air we breathe in, which is called tidal volume, which is about almost half a liter. So the volume increases, your work of breathing increases. Then the work or power will be, actually power will be your work time divided by your time. So what you're all talking about is, a normal breathing will consume about 5% of your body's calorie or body's energy. So average person between 125 to 150 pounds, an amount of calorie intake about 10 to 15 calories per pound. So average 150 pounds person will consume between 1500 to 2250 calories. So average will come up, excuse me, average will come up, which is our standard is about 2000 calories. So 5% is nothing. 5% is what? 50 times 200, 100 calories. But also our observation is, in our medical practice, what you notice, when you put the patient on respirator, we're doing the breathing, artificial breathing, patient used to need a lot more energy. We used to put them on called a TPN, called Total Parenteral Nutrition. And calculated at the time, the workout breathing goes up almost 20%. So 20% out of 2000 will be your 200 plus around 400 calories. So by able to do a very active pranayama practice, you'll be able to burn probably around 400 calories. And also in active pranayama, you'll see that you will be almost doing a cardiovascular training. How do you know? We know because we have this Apple Watch, we have all the heart monitors, and we are regulating and looking at it during our practice. On the other hand, if you look at a comparing value, if you're in a treadmill or if you're walking, look at what are the numbers. Average person on a treadmill, average person between 125 to 150 pounds, or 150 pounds average on a treadmill between 3.5 to 4 miles an hour without any inclination, will burn probably 4 calories a minute. So if you're on the treadmill for 30 minutes, you're going to burn only 120 calories, which will do a lot of work. To maintain our normal calorie requirement, we need to burn about 300 calories than what we are consuming. So when you talk about 10,000 steps, we talk about 10,000 steps, taking 10,000 steps is a daily healthy practice. One step generally is about 2.5 feet. So 2.5 times 2 to 2.5 will be okay. So 10,000 feet will 10,000 steps. 2,000 steps will be probably around a mile, so around 5 miles. We're going to walk around 5 miles for 10,000 steps, and you will be able to burn between 300 to 400 calories. So let's come back again, workout breathing. Why the person lost or loses 40 pounds? But another interesting yoga practice is, the yoga practice is a balance. Yoga brings a health. Health is a balance of our body, mind and spirit. So what happened, the person who is a little overweight, and we know from Ayurvedic perspective, overweight means their Agni, the digestive fire is low. Because digestive fire converts your food into 7 tissues. Plasma, Rasha Dhatu, red blood cell, Rakta Dhatu, muscle tissue, Mamsa Dhatu, fatty tissue, Meda Dhatu. Fatty is the number 4th tissue it forms. 5th is a Asti Dhatu, bones and joints. 6th is your Majja Dhatu, nervous system and the bone marrows. And finally the Shukra Dhatu is your reproductive tissue. Then it forms ojas, which is your cellular immunity. So when your digestive fire is low, the tissue doesn't progress beyond number 4, which is a fatty tissue. So in yoga and Ayurveda, the treatment of obesity is igniting your fire, called Agni Deepana. That is done through your Kapalbhati Pranayama. So Kapalbhati Pranayama will ignite your Agnis, so you are going to lose weight. On the other hand, people with malnutrition or low body weight, primarily it is also a digestive disorder. The digestion process, they also have a low Agni, the digestive fire. So able to do a proper pranayama practice with the Kapalbhati Pranayama, they also get a proper digestion, they start gaining weight, and they come to a balanced body weight. So yoga practice brings a balance. If it is malnutrition, it brings up to the normal body weight, and if it is a obesity, it also brings it down to normal body weight. So the first, a resting breathing. My eyes are closed. I'm not making any effort. I'm breathing in and out involuntarily. Remember, breathing is both conscious and subconscious. I'm sleeping, I'm breathing. That's the unconscious function of my brain stem. Breathing also can be conscious. I can breathe out first. I can take a deep breath in. Breathe out longer than breathing in. I'm already started burning more calories. So the first practice, what do we do? Breathing out longer than breathing in, exhalation longer than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. Longer the exhalation, longer our longevity. So the practice we do, we sit down in a comfortable, if we can sit down in the ground, we do it. This is called your Sukhasana, easy pose. And as you know, all the time, I change my feet every often to activate both sides of my brain. Put your feet under your knees, keep your spine straight, take your hands, touch your index finger and thumb, put it over the knees, close your eyes to quiet down your mind. Then after regular relaxation asanas, which are primarily like a Paschim Namaskar, prayer pose to the back, Brahma Mudra, moving all the necks in 4 different directions, and relaxing your hands, shoulder, back, and the lower part. Remember, in the yoga practice, when you relax one part of the body, the rest of the body also relaxes. Relaxation response. So the way we keep on practicing is that when you keep doing it, you develop a phenomena called neuroplasticity. Neuroplasticity basically is a habit forming. Once the habit is formed, you breathe also like that when you are sleeping. Simply when you start, and you can always start with me and see how far you can go, you breathe out first. Breathe in, count of 2 in, count of 4 out. 1 and 2 in, count of 4 out. So we're doing 2-second inhalation and 4-second exhalation. And if you keep doing it for a while, the neuroplasticity will set in. Then you will be able to breathe now, say 4-second in, 8-second out. I'm jumping one step. You should, if you cannot do it 3-second in, 6-second out. Continue will happen. I want to show you how we practice and where we come up now. I'll breathe out first. I'll do 4-second in, 8-second out. Very easy for me because I'm doing it for a long time. But in the process, what happened, your breathing rate started coming down. Normally I was breathing between 15 to 16 breaths per minute. When you get to 2-second in and 4-second out, 6 seconds for a cycle, breathing rate already dropped down to 10 per minute. I can do 4-second in, 8-second out, 12 seconds for a cycle. The breathing rate drops down to 5. Let me show you 6-second in, 12-second out. Simple. And also remember, this is my normal breathing, completely effortless. I'm not making any effort at all. Effortless breathing, but I'm burning more calories. I'm also feeling a little warmer inside my body. Eight-second in, 16-second out. Breathe out first. Wonderful. 8-second in, 16-second out. I'm effortless because I'm still talking, I'm even singing. I'm totally in a normal state of breathing. My work of breathing getting bigger and larger because it's a pressure times volume. I'm increasing the volume. And when the neuroplasticity sets in, also breathe like that when I'm sleeping. I'm also burning some amount of calories. Now, when you do a stuff like a breath holding, you generate a higher pressure and also your carbon dioxide get retained. You also produce more heat. Like today, in the newspaper, in the Parade magazine, there's a section called Ask Marilyn. Marilyn is regarded as have a highest number of IQ, intelligence quotient she has. The question was asked to her, when I sleep on my face down, I feel more warmer than when I sleep with my face up. Answer is very simple. When you're putting your face down, you are not able to breathe out as comfortable when you're laying down and doing breathing in and out. In fact, when people are wearing masks, we know that people wearing masks, they feel warm. They feel more warmer because remember, the issue with the mask is you can breathe in because inhalation is active. Exhalation is passive. We have a muscles of exhalation, but exhalation is still a passive. So with the mask on, exhalation is not complete. People feel warm. Also the skier has incorporated this in their practice. They use a face cover. There's a face cover to prevent your nose and lips from a frostbite because of the cold, but it also warms them up. So once you understand the concept that work of breathing burns so much of calorie that you're bound to lose weight, and it also ignites your digestive fire. You're bound to gain weight if you have a malnutrition, and bound to lose weight if you're overweight with that extra fat. Then comes your Bastrika Pranayama, bellows. And bellows is a powerful your calorie burner. Because in a bellows, a Bastrika, doing it for a short time, first you feel a tremendous amount of warmth. You feel hot within you. It also creates a hyperventilation syndrome, altered sense of consciousness that is due to vasoconstriction of the blood vessels going to the brain. We used to use hyperventilation for people with a head trauma, neurosurgery. We used to put them on respirator, create a hyperventilation to reduce the intracranial pressure. So hyperventilation definitely is a big calorie burner. Now if you do it, just simply the simple way of practicing, the way we do it, I said we're active inhalation, active exhalation. And here, I can go back, I can go to your workout schedule, I can open all my goals and see what is the effect. Normally do for the balance, as you know, when I'm showing it to you, I was doing inhalation here, exhalation here. But in yoga therapy also what you do, you will do a inhalation here, exhalation here, like this. We do the neti part, gel neti, every morning. We use a nasal washing to keep our nose open and also keep both the nose equally open. You will always see throughout the whole day one nostril is more open than the other. If you are if you are doing the practice with me, you can test it. Close your right nostril. You don't have to go all the way down. Just close underneath and breathe in and out through your left nostril. Close your left nostril, do in and out through your right nostril. For you, you'll see your one side was easier than the other side. It alternates. But because of our morning Jalneti, the neti pot practice, washing all the debris inside and equally open both the nostrils, both of our nostrils equally open. Now, if you say a little faster Bastrika, and if you can do with me, and you will see the amount of heat you generate to burn the calories. I generally do a Adhi Mudra, it's very relaxing, and I will be doing it doesn't take much time, very short time, but it is a tremendous amount of calorie burn. That is called a breathe and burn. Let me show it to you. It's a rapid Bastrika Pranayama. I just did only 1 minute. I can look at my heart rate now. The heart rate has dropped down a little bit because probably it is about 62 now, because I ran a little low heart rate. But look at that, with a low heart rate, I'm doing a tremendous amount of your burning. We get a little bit of a cough, little bit, because all of the coughing comes from your larynx. Like when you Ujjayi Pranayama, Bastrika Pranayama, it happens to all of us. Now, when you can do a further very rapid Bastrika Pranayama, you'll be burning a lot more. But generally you don't start. You start exactly with how much you can do with completely effortless breathing. And if you keep on doing it, you just increase the speed and the time, because this is a voluntary regulated breathing. Remember, pranayama practice is not a breathing exercise. It is a voluntary regulated breathing. And let me show you an example of a rapid Bastrika breathing, and you will feel how much calorie you are going to burn. It is almost sometimes better than your cardiovascular and cardiac stress test. I mean, I do stress test, and I do a treadmill. I do about 3 days, Monday, Wednesday, Friday, exactly a stress test. So can I give you the numbers? Let me show it to you. I did 600 of those. Generally, it's about 3 breaths per second. I did about 3 minutes. Look at, I'm already perspiring. My whole body is perspiring. I'm feeling hot. My pulse rate now is 122. So what is my target heart rate? My target heart rate is, for a stress test, 220 minus your age. My age is a number, and that number is unlisted. Your number is how you feel. So my maximum heart rate will be around 150. I'm already achieving around 85% of my maximum heart rate. But also very interesting is, within a short time, my heart rate is all coming down. That is called parasympathetic activation. I have a saliva in my mouth. I'm still in a parasympathetic state. With all the rapid Bastrika I have done, you still have a parasympathetic response. I'm continuously measuring my heart rate. So when you do this, think about it. Within 3 minutes, you've already achieved your maximum heart rate. Perspiring, you are having a cardiac stress test. And when you incorporate some asanas, like if you incorporate some, say, sit-ups, with this bellows breathing, Bastrika Pranayama, you'll be surprised how much work of breathing you do. Also, if you can do a rapid Bastrika with a hand raising high up, the way we do it, I'm going to show you just one cycle. You will see, generally do it multiple of cycles. One cycle we do with a 20 slow, 20 medium, and 20 fast Bastrika Pranayama. 20 slow. The 20 slow. It is 20 medium. And 20 fast. Time for your health parameters. Go back to check your first heart rate. (103) pulse rate. Within this just 60, we got a pulse rate of 103, and if I can continue more, and it is going high up and then coming down. We generally do it between 3 to 4 cycles. If I am more interested on my health tracker, I get an EKG. I'll be doing an EKG here now. It picks up 30 seconds of EKG. So it says normal sinus rhythm, and it is 106 beats an average. So when you go with your work of breathing, with your heart rate, which is calculated on the treadmill, you are going to burn with the daily pranayama practice between 300 to 400 calories. And then when you incorporate a asana with a Bastrika Pranayama, I'll show you the other fat burners, which is called your Kapalbhati Pranayama. But see, when you can incorporate this, you will see the effect of it a lot more. This will be your Bastrika Pranayama with your sit-ups. You can do very simply, incorporate Bastrika. I always try to do it with my eyes closed. Gives me a better perspective of my breathing. Like this. Again, checking my heart rate. Almost 138, 140 now. So think about, I did 22 sit-ups with my Bastrika Pranayama. And it is coming down because of my parasympathetic activation. So all the numbers, figures, which you give it to you, it is from our own experience, research, and also in touch with other yoga therapy groups. I'm still talking, I'm breathing, I'm within my heart rate. Came down to almost 110 now. Many a time we do it moving our hands more. That burns more calories, increase the heart rate. It will be like this. Sadharan Dand, Ram Murti Dand, Palwani Dand. You also can move your body front and back with your Bastrika Pranayama. Also do your longer exhalation than inhalation. We show it to you. I will do one inhalation against the 3 exhalations. What a wonderful practice we have gained. Now you know what is meant by breathe and burn. So I did 1 inhalation with 3 exhalations. My heart rate got up to 126. I only showed you only 3. We generally do 10, 15. Then also other thing, do the same 3 exhalations with moving your body front and back. You can feel within yourself the amount of energy expenditure in your body. Hundred 29 beats per, and now 139 beats per minute. So now you understand what is meant by breathe and burn. So Bastrika, or the bellow, is the biggest fat burner. Our most important sign of ill health is our truncal obesity. This is the fat which is stored inside your abdomen, which is called an omentum. The fat is not under your skin. And I have shown it to you, a sign of called yogic BMI, the body mass index. Your wrist overlaps up to the middle part of your thumb. You take the hand, put in the middle of your arm, separation will be same as what was the overlapping in the wrist. In your thigh, from the hip bone to the knee, in the middle, you will be able to put both the hands together and touch. And in the abdomen, to reduce the truncal obesity, put your hand here and both the fingers will come and touch. We all develop some truncal obesity when you're getting mature. You don't get old anymore, mature. The next fat burner is your Kapalbhati Pranayama. Kapalbhati Pranayama you do with the mudras. You do about 10 different mudras. We do about 50 with each mudras. It's almost 500 counts. Awareness in the belly button, goes to the back, it hits the diaphragm, hits the lung, air comes out. If you're new to the practice, put hand in the belly, push your belly to the back, air will come out. You put your hand against the air will come out. It's a wonderful practice. So the way we do it, I'm going to show you a little less because of the time constraint. We don't have too much time. We start with called a Dhyana Mudra or Jnana Mudra, then change to, that is, quiets down your pitta, quiets down your mind. Vayu Mudra quiets down your vata, very good for chronic pain. Sunnah Mudra, or infinite, it helps your hearing. Prithvi Mudra, it is balances your kapha, grounding, good for your obesity and diabetes. Varun Mudra, touching your fire and the water element, It balances your water and it controls your bladder function. Shakti Mudra gives you the strength. It is Shakti means strength. Apana Mudra, middle finger, ring finger and thumb, also called Pachan Mudra, Digestion Mudra, Clearing Mudra. It causes your digestion. Index finger down, called Apna Vayu Mudra. This is called a Hridaya Mudra. This is good for your heart and lung function. Linga Mudra warms up your body, removes the flames from your lung. Very common for the babies. They will do it. Ganesh Mudra, removal of your obstacles. Hakini Mudra, Shankha Mudra, Dhenu Mudra. All these mudras have a health function. I've done it so many. You can go to my YouTube and look at that, and we'll do another one. So the way we do it every, right? And we keep on doing it. Every time you do a Kapalbhati Pranayama, it ignites your Agni, digestive fire, which is called a Tejas. Prana, Teja, Oja. Teja is a glow. Looks like you are glowing. That's the word Kapalbhati. Kapal is a forehead, Bhati is a shining. Looks like you are shining. It massages all the internal organs. So here it is. If I'm doing it, nothing moves. Belly button goes to the back, 1 per second. On the 20, I'm changing my mudras. I already have some saliva in my mouth, parasympathetic activation, and you keep doing with me. Let me tell you again the benefit. Massages all the internal organs. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon, massages your small intestine, massages your kidneys. For the women, it massages your uterus, ovaries, fallopian tube. For the men, it massages your prostate. It also massages your bladder. Shunya Mudra, it also massages your diaphragm. So the two nerves, the vagus nerve, left and right, which is the anterior and posterior vagus nerve, at the level of the gastroesophageal junction, they also get stimulated with Kapalbhati Pranayama. Vagal activation is a parasympathetic response. Vagal activation is the outcome of your yoga practice. Massages the lung, all the dirty, toxic gases in the lung comes out. The Detoxifying Pranayama. Prithvi Mudra. Between the lung is the organ called the heart. It also massages your heart. Massages very gently in the lower part of the heart. When the heart is not properly functioning, we do a chest compression. Even somebody stops heartbeat, cardiac arrest, we do a called CPR, cardiopulmonary resuscitation. We do the chest compression, it massages your heart. Varun Mudra, we used to even open the chest, left chest. Hold the heart in a hand is to massage in an incidence of cardiac arrest in the emergency room. Think about it. It's massaging the heart from inside very gently in a sequential manner. It is called internal CPR, Shakti Mudra. Normally, I don't talk because as I'm talking to showing it to you, my breath is normal. We just keep your spine straight, eyes closed, keep on doing it. Apna Mudra. You can continue. This is also called a Metabolic Pranayama. It corrects all the metabolic issues. Extend this pranayama with your breath holding. Both breath holding in inhalation, breath holding in exhalation. Both are warming. Breath holding and exhalation. So when you inhale, inhalation, when you hold the breath, called retention. Then you exhale, exhalation, called suspension. So this is your abdominal lock. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. You can feel the effect of it. After that, you get to breathe in and breathe out. Your volume, tidal volume, becomes 3 or 4 times more than the regular breathing. You can bring it up to called Agni Kriya, moving the abdominal wall with your abdominal lock. Breathe out first. We'll take a deep breath in, breathe out, and then move the abdominal wall. It massages your momentum. And again, yoga, if you massage an organ, the organ gets better and organ functions better. Same way, when you do the breath holding in inhalation, you can feel it warms you up and you will be able to feel the heart rate goes higher. Even it's very calming, cooling, relaxing. Because of the breath holding in inhalation, we do a chin lock called your Jalandhar Bandha, and that is called your Murcha Pranayama. It is so relaxing, looks like you're almost passing out, called murcha, means passing out. The technique is, you breathe out first, take a deep breath in, hold your breath, bring your chin close to your chest wall. Hold your breath and keep counting how long you can hold. Time to check again after just one breath. One breath holding, and see when I came back to normal, my heart rate is showing 4 minutes ago was 60. Now it is 100. So it was 60, became 100 with a breath holding. So I'm giving it to you, the breath and burn, and we are monitoring through our health tracker. It's like a stress test, you are doing it. I'm recording my heart rate, I'm looking at my EKG, I'm looking at my whole cardiac function. Alternate nostril breathing also brings some effect, but it primarily affects both sides of the brain, brings a balance, it balances your vata, very good for your hypertension, very good to improve your memory, Alzheimer's disease. Same as Bhramari Pranayama, bumblebee, it also quiets down your mind. When you quiet down your mind, also remember in yoga it says, more relaxed you are, more calorie you burn. You get more strength back. Completely opposite concept of Western thinking. Completely relax. It's called a Shakti Asana. Shakti means strength. Ujjayi Pranayama and Shankar Pranayama also is a very good calorie burner. So Ujjayi Pranayama, as you know, it slowly constricts your larynx, and then it supplies by the vagus nerve, superior and inferior laryngeal nerve. It is a vagus nerve activation, and it is primarily a profound parasympathetic tone. Incorporate that with your chin lock, Jalandhar Bandha, and a left nostril breathing is called your Chandra Vedi Pranayama or cooling. It becomes a profound cooling pranayama practice. But it also has a very high incidence of work of breathing. Let me show you one time. So, generally when you practice initially do a slowly constrict the larynx. It's like it will sound like almost like a breath of, like a ocean breath. Then when you slowly learn how to constrict in a relaxed way, it will be sounding like this. Finally, when you do a full Ujjayi Pranayama, you will breathe out first, breathe in, breathe out, and do Ujjayi Pranayama. Ujjayi Pranayama with the chin lock and the left nostril breathing. We'll finish with our Shankar Pranayama, which is called Resistive Exhalation, which is an excellent your fat burner, excellent calorie burner. Generally, we finish with a meditative practice. A meditative practice in a pranayama, whole pranayama is a meditative practice. Because the whole pranayama practice is completely effortless and breath is the connector between body and mind, and it quiets down your mind very well. In the Shankar Pranayama, what you do, you put your hand is like a yogic fist and create like a conch shell. So this is your called Balo Mushti Mudra or Adhi Mudra. You close it, put one in the top. All the breathing we do through our nostril. We don't breathe through our mouth. Because when you breathe through our nostril, air goes in, first gets filtered, then nose is like a personal air conditioner. If outside air is warm, it will cool it down. Outside air is cool, it will warm it up. It goes to the side of the nostril called turbinate. Then it goes over the mucosa of the sinuses, which releases nitric oxide, a potent vasodilator, activator of your parasympathetic tone. Then it will go down to your larynx, the trachea, and to the lung. But if you breathe through your mouth, you really don't know where the air has gone in. But if you really have to breathe through your mouth, then we'll breathe in through your nostril, breathe out through your mouth. Only difference is, in that process, you lose the function of the muscles of exhalation. So let's finish today with the Shankar Pranayama. We'll do 3 Shankar Pranayama. Breathe in through your nostril, breathe out through your mouth against the resistance. Breathe out first. Take a deep breath in. Mouth is full of your saliva. This is your parasympathetic activation. Think about that. I'm here over almost close to your hour and a half. I've been talking. I'm not drinking any water, nothing. My mouth is still very wet. Another Shankar Pranayama. Breathe out first. Take a deep breath in. Thank you for joining this important session, Yoga Therapy, Breathe and Burn. And it's almost like a Western advertisement, money back guarantee. If you do it from your heart, if you do it, not the person. Actually, the person who started, I gave you the first example. He was 53, had a typical metabolic syndrome. I used to see him quite often. He said, yeah, I'm doing it. But then finally he admitted one day, he said, every time I see you, I said, but I was not doing it, regularly. But the moment I saw my belt lost 2 notches down, that triggered me. And that helped me get me out of 18 medications. So here, we'll come back every Saturday and Looks like I will be in town, even the pandemic is over. Nobody is returning back to our in-person practice yet. So we'll be continuing this virtual. In fact, this may be the next normal for our lifestyle. Thank you for joining. If you have any question, please put it in my Facebook page. I'll be able to answer. And I give you all the physiological explanation how the breathe and burn works.